My name's Emma Taylor. I am the Parent Carer Liaison Officer for ARFID Awareness UK, the UK's only registered charity around ARFID. I'm also parent to a nearly 5-year-old child who suffers with ARFID. His name is Oliver. So we're here to talk about avoidant restrictive food intake disorder. What is ARFID? Avoidant restrictive food intake disorder is a condition that causes one to limit the amount and type of food one eats. It's not the result of a disordered self-image or an attempt to lose body weight, seen in other types of eating disorders. Some refer to ARFID as selective eating disorder. There are 3 main issues associated with ARFID. Not being interested in eating. Avoiding food that have an unwanted colour, taste, texture or smell. And feeling anxious about the consequences of eating, like choking on food or vomiting. ARFID is a health condition that requires assessment, diagnosis and management. It was formally recognised as a type of eating disorder only in 2013. It's now included in the International Classification of Diseases, the ICD-11 of the World Health Organization, and in the Diagnostic and Statistical Manual, the DSM-5, of the American Psychiatric Association. The DSM-5 also outlines 3 primary factors associated with ARFID: sensory-based avoidance due to sensitivities to smell, taste or texture, avoidance linked to negative experiences such as choking or vomiting and resulting in an anxiety about eating, also a lack of interest in eating or food intake. According to ICD-11, ARFID is avoidance restriction of food intake that results in the intake of an insufficient quantity or variety of food to meet the adequate energy or nutritional requirements that has resulted in a significant weight loss, clinically significant nutritional deficiencies, or a dependence on oral nutritional supplements or tube feeding, or it has otherwise negatively affected the physical health of the individual, or a significant impairment in personal, family, social, educational, occupational or other areas of functioning. ARFID is not motivated by a preoccupation with body weight, shape or size. Restrictive food intake and its effect on weight, other aspects of health or functioning are not due to unavailability of food, and it is not a manifestation of another medical condition like food allergies, hypothyroidism or a mental disorder, and are not due to the effect of a substance or medication on the central nervous system, including withdrawal effects. Is ARFID the same as picky eating? No, ARFID is not the same as picky eating. Picky eating usually only targets a few foods. Picky eating doesn't affect the child's appetite or their growth or development. And picky eating often goes away as a child grows. ARFID can cause complications that affect the appetite and overall health due to inadequate nutrition. It doesn't go away and it needs treatment. How is ARFID different from other eating disorders? Other eating disorders like anorexia nervosa are linked with body image or self-image. Those with these type of eating disorders are concerned about their weight and how they looked. Instead, people with ARFID are not concerned about these things, their weight or how they look, but could be concerned about other things like the taste, texture or smell of food, choking or having an allergic reaction with certain types of food. Or they might just not be interested in eating. How common is ARFID? ARFID can affect a wide range of children, young people and adults. Evidence suggests it is more common in autistic individuals. The exact prevalence of ARFID and its co-occurrence with autism is difficult to establish due to various reasons. One, ARFID is a relatively recent diagnostic category in the ICD-11 and the DSM-5. There is limited awareness of ARFID amongst healthcare professionals, and autism is not always diagnosed in a timely manner in children and young people. But estimates do indicate around 5 to 22.5% among children and young people in specialist eating disorder services are reported to have ARFID. Between 0.3 and 15.5% of children and young people are reported to have ARFID in non-clinical samples. Of these, between 8.2 and 54.75% are reported to be autistic.